Module 1, the scientific method. The alpha generation of children refers to children born or who were babies in 2020. They tend to have developmental delays with their speech and language, feeding issues, emotional troubles, cognitive impairments, regression of physical skills, and difficulty in learning. All due to being born in, or right before, the year 2020. Research has shown the impact of the COVID-19 pandemic and the lifelong effects that it will have on Generation Alpha. When these children were babies, they experienced something that had never happened before: lockdowns and restrictions for months and years. COVID-19 guideline restricted the interaction and touch of extended family members and pediatricians. Daycares and schools were closed, newborns could not see their grandparents, parents were forced to create new rules and limit social and physical activities. As these children grew, so did the signs of neurodevelopmental delays, academic, social, and emotional concerns. Researchers jumped into action, making a hypothesis about what this will mean, and started collecting data to support the impacts of the pandemic. What research has shown is that there will be lifelong issues with COVID babies, from getting sick more easily to PTSD and emotional exhaustion. How does research do this? It starts with the scientific method, which is a systematic approach used in research to develop and test hypotheses in order to reach conclusions. There are 7 steps that are followed. The first step is to identify a research question or hypothesis. This can be driven by the researcher's passion for a specific subject or need, due to an increase in social pressures. Conducting a literature review to review the existing research literature, which was brand new for the COVID-19 pandemic. There has been research into outbreaks, but nothing like what hit the entire world. Developing a research design is a study to look at the impacts that teachers, parents, caregivers, and communities were seeing with young children. The data collection phase involves gathering empirical evidence through various research methods such as surveys, experiments, or observational studies. After data collection, researchers analyze the data to test their hypotheses and answer their research questions. Based on the data analysis, researchers draw conclusions about the research question or hypothesis. What are the immediate implications from the pandemic on children, and then the overall lifelong impacts? Finally, researchers report their findings in scientific journals, conferences, or other academic forums. This can help direct the flow of resources and additional research studies. This last step in the research process is to disseminate the results, and this is where being an informed and critical consumer is important. Being a parent of a COVID baby and knowing the possible impacts or any other research topic that affects your choices. When gathering information, the consumer needs to access information from magazines, newspapers, scientific journals, making sure they are reliable and credible. Research refers to a process of conducting studies or using existing knowledge to answer questions related to human behavior and mental processes. This process can include synthesizing and analyzing previous research. Synthesis involves combining and integrating multiple sources of information to create a new, more comprehensive understanding of a topic. When we synthesize, it allows us to see if there are some patterns or common themes that we can then develop into research. An example of this might be looking at anxiety and seeing what past research has shown to help clients reduce their levels of anxiety. Analysis involves examining and interpreting data or information to draw conclusions. We might analyze information through statistics, looking over transcripts, or seeing the results from surveys. With our anxiety example, we might look at the statistics that Harvard Medical has shared with the use of anxiety medications and their side effects, or the use of medications and therapy. What we're doing with research is trying to figure out if there are any gaps in our existing knowledge, which can then generate a new hypothesis or research question. This can lead us to new discoveries of a relationship between two variables, or even a new theoretical framework. Research can be conducted in different settings, from the laboratory where we can have more control over what is being done, or in a natural setting, for example schools, workplaces, and hospitals. Research methods involve procedures and techniques that can be used to identify, collect, process, and analyze information to answer research questions or test hypotheses. Two commonly used research methods are systematic and scientific research methods. The systematic approach involves a step-by-step process that is planned and implemented to ensure that the research is thorough, reliable, and valid. This typically involves defining the research problem, conducting a literature review, formulating research questions or hypotheses, designing the research study, collecting data, interpreting and drawing conclusions, reporting and disseminating the results. This is also called the scientific method that we looked at earlier. This is a common foundational aspect to all research methods. Experimentation is a research method where one or more independent variables are manipulated to observe the effects. We usually see experimentation conducted in a controlled environment so that we do not have a higher risk of influencing the results. There are 7 key components to experimentation. They are independent variable, dependent variable, control group, experimental group, random assignment, operationalization, and data analysis. The independent variable is something that we can manipulate within the experiment. For example, in a study examining the effects of yoga to decrease anxiety, we can manipulate the type of yoga that we use in the experiment. We can use just original yoga versus nothing, or we can get creative with the types of yoga vinyas, goat and hot yoga for example. The dependent variable is what we measure. In our example, this would be the level of anxiety. The control group is a group of participants that is not exposed to the independent variable. They create the baseline for the research. The experimental group is the group of participants who were exposed to the independent variables. Random assignment is the process in which the participants of the research study are assigned randomly to either the control group or the experimental group. Operationalization is the process of defining and measuring the variables in a way that is objective and consistent across all the participants and the groups. Data analysis is the use of statistical techniques to analyze the data that is collected from the experiment and to determine if the independent variable influenced the dependent variable. We mentioned the independent and dependent variable as key components in an experiment. Variables refer to the measurable characteristics or factors that can vary or change in a research study. Variables are important in research because they allow for the researcher to measure and observe and test the hypothesis about the research subject matter. There are 2 main types of variables: independent variables and dependent variable. Independent variables are those factors that the research manipulates or controls in a study to observe their effect on other variables. Independent variables are often referred to as the cause in a cause-and-effect relationship. Dependent variable assess the effect of the independent variable. Dependent variables are often referred to as the effect in a cause-and-effect relationship. The example we have used with using yoga to decrease anxiety. We would conduct a pre-study anxiety assessment to give us a baseline of where the participants are with their anxiety level. The participants would be randomly assigned into a control group that would not get any yoga or into the experimental group that will be taking yoga classes. After a certain amount of time, the participants would then take a post-study anxiety assessment to see if the yoga had reduced their anxiety level better than the control group that did not have the yoga classes. Variables, objectivity, bias, and order of conditions are important considerations in research methodology. Let's briefly explain each concept. Variables are characteristics, attributes, or factors that can vary or change in a research study. They are used to measure or manipulate the occurrence being studied. Variables can be classified as independent variables, which are manipulated or controlled by the researcher, and dependent variables, which are the outcomes or responses that are measured or observed. Random assignment is the distribution of participants to conditions that is random when each subject has an equal and independent chance of being assigned to every condition of the study. For example, being able to be assigned to the yoga group /S or assigned to the control group. The order of conditions refers to the order in which the conditions or treatments are presented to participants. The order of conditions can potentially impact the research results. For example, if the participants were in the yoga class and then were placed in the control group. This might alter their input into the results. The goal for a researcher is to maintain objectivity, which attempts to minimize the sources of bias and have an impartial and neutral research process. The results of the research are based on evidence and data without being influenced by personal biases or preconceived notions. The researcher can strive to identify and minimize all forms of bias, use reliable and valid methods, make their research transparent and replicable. The researcher should base the results on the analysis of data rather than personal opinions and beliefs. Allow for the study to receive peer-reviewed comments and acknowledge limitations where uncertainty and conflicts of interests might have been fostered. Bias refers to any systematic error or distortion in the research process that can affect the accuracy or validity of the research findings. There are several sources that can be seen: researcher bias, participant, measurement bias, or publication bias. Jackson, 2016. What makes someone want to do research? It starts with a question that someone wants to answer, and that is the foundation of a hypothesis. A hypothesis is a testable prediction about the relationship between two or more variables. For example, we might want to know why we feel better when we are outside in the sunshine, or if classical music really does make us focus better when we are trying to study for the exam. How do we form a hypothesis? There are 3 different methods that we will look at: empirical, rational, and authority. Empiricism is wanting to generate knowledge about the natural world. It relies on experimentation, surveys, and observations. An example would be children learning specific behaviors by watching their parents and older siblings. Empirical research to test this hypothesis could involve studying children's interactions with parents, caregivers, siblings, peers, and their environment. Researchers could also conduct experiments where they manipulate the interactions and modeling to investigate the impact on the child's behaviors. The results from this research could be used to support or challenge the hypothesis and can contribute to our understanding of how each child learns behaviors. Rationalism is based on reasoning and empirical evidence that can be tested through scientific methods. The researcher can use observation to measure and analyze data to test the validity of the hypothesis. The hypothesis is developed through deductive reasoning, starting from a general theory or existing knowledge, and generating specific testable predictions. An example to test this hypothesis would state that the increase in physical exercise will result in a decrease of symptoms of anxiety in adults diagnosed with general anxiety disorder, GAD. We can state this hypothesis and conduct this research based on the knowledge that increased physical activity has been shown to have numerous mental health benefits. We can also know that the diagnosis of general anxiety disorder is characterized by excessive or unrealistic worry that is difficult to control, a sense of restlessness, tiredness, shakiness, or muscle tension. There is also the feeling of constantly being on the edge and having difficulty staying or falling asleep. Hypothesis would suggest that if a person who has general anxiety disorder increases their physical activity, their symptoms of anxiety will decrease as a result. The last method that we can use for forming a hypothesis is called authority. This method is using the expertise of an expert in the topic area that you want to research. An example is a researcher who is studying the effects of tic disorders in young children. The researcher would consult with a renowned neuropsychologist expert who has extensive experience in working with children who have formed functional tics. The neuropsychologist will provide insight based on their clinical experience and knowledge of functional tics, suggesting that cognitive behavioral therapy has been shown to decrease functional tics. The hypothesis is based on the neuropsychologist's expert opinion. The researcher can form the hypothesis: the use of cognitive behavioral therapy can reduce the severity of functional tics. The researcher relies on the expert's opinion as an authoritative source of information, considering their expertise and experience in the field. The expert's input serves as the basis for the hypothesis, proposing a specific method for the treatment of the issue. The researcher would then design the research study to test the hypothesis. They would use whatever is the most appropriate research method, like observations, experiments, or surveys, and collect the data. The final aspect for the research study is to analyze the data and see if it supports the hypothesis and publish the findings. A hypothesis will be testable, refutable, positive, and logical. A hypothesis should be able to be testable through empirical research. This means that when the data of the study is analyzed, it will either support or refute the hypothesis. A hypothesis should also be refutable, which means that it can be proven false if the evidence doesn't support it. Researchers need to be aware that sometimes their hypothesis is not going to be supported with empirical findings. This just gives the opportunity for the researcher to revise or refine their research study if new information becomes available. A hypothesis should also be positive in that it should support the findings of the research. A hypothesis should lastly be logical, which means that it is consistent with current knowledge and theories in the field. It can help the understanding of current views, build on them, but is not so far out of the realm of what is acceptable in the field. Jackson, 2016. In the following modules, we are going to look at ethical concerns, research participants, types of research studies and statistical methods that a researcher needs to consider when setting up research study.